in the lining of your blood vessels. Okay, so it will mean end up having fairly high, very thin, and that will increase chances that you suffer from high blood pressure. Please mute yourself. Mute yourselves. If I knew who is talking, ningekutoa plus. Just mute yourself, please. So the third cause or risk factor is substance abuse. When you use full substances. Okay, so smoke. When you take alcohol excessively, when you use recreational drugs, okay, all this will have an impact on an organ within your body. Okay, so when you are using these harmful drugs, they increase for you to develop a lifestyle disease. The other factor is your level of stress and mental health. Okay, so when you have a mental health, for example, you have a long-term, that can increase your blood pressure. That can also lead a weak immune system. Okay, so when you have a long-term stress, you end up unhealthy coping behavior. So people who are stressed, some at times they end up, for example, alcohol. Okay, so at times people respond to stress differently. Na wale wenye akikuwa stressed atakula. Okay, so by overeating, for example, as behavior to your stress, then now you end up being obese. There are those, because stress, they might now even begin smoking. Okay, so what is leading you into doing what you will not have is this long-term stress. Then your coping behavior, how you cope with that long stress, is now what leads to the development of the lifestyle disease. Some causes of this stress long-term could be, for example, if you are employed, yet you have bills to pay. You could as well be employed, but then you are undergoing financial difficulties. At times, you can have either emanating from your social circles or from circles. So these can be causes of long-term stress. Then as you respond to the long-term stress, you either can overeat, you either can smoke, either can go into alcohol. So that is now what will make you the lifestyle disease. Then there are factors: where you live, the surroundings where you live. Okay, so if, for example, where you live, you have a higher air, that you have a higher chemicals, or you are in an area which has poor levels of sanitation, this will increase risk of disease. For example, air pollution will affect lungs. Then that can lead to the development of respiratory diseases. So you can have like asthma, developing where you come from, where you live, the sanitation are not proper. At times, you can also have family history and genetics. Okay, so people, for example, where you have a certain lifestyle disease running within a family. You could have, for example, diabetes, hypertension, just running within a family. You have it for a grandfather, you have it for a son and a grandchild. So that will show that such people likely to develop that particular disease. Okay. So usually, even when someone carries the gene that can cause that disease, the genes alone cannot cause the disease. So when you come from a many people have these lifestyle diseases, you just need to, it should just show you that you need to take yourself more. Because if you don't, chances that you develop that lifestyle disease are very high. But it is not automatic. So the choice of will either increase or reduce your risk to the occurrence of that. Even when you carry the genes, it is a factor. Which choice are you making in your life? So when you have a friend, a brother, or a parent who has a disease, the more reason now to be careful with how you live life, because that will show you might be having genes, a genetic predisposition to that lifestyle disease. The type of choices you make on how to live your life will most likely increase the risk that you develop that disease. So that should just be like a warning call. So in summary, lifestyle diseases are mainly by modifiable factors, which means by being modifiable, it just means there are things that can be changed. So when you change and you begin to have healthy diets, you begin to have regular physical, when you avoid harmful substances, to manage your stress better, such will help to greatly reduce the risk that you develop lifestyle diseases, even when you have the genetic predisposition. So for you to be safe then, you just have to choose healthy eating, regular physical activity, avoiding harmful substances, and being able to manage your stress better. Okay. I don't know who that is.
Michael Simiyu, please behave. We are having a class and you are making noise. All those who are unmuted, mute. You make noise, we'll just get you out of class. Doctor, let's proceed.
Okay, yeah, thank you, Buni. I think he's listening to one of the questions. So we've seen how to prevent the occurrence of lifestyle diseases. One of those is healthy eating habits. The second is regular physical activity. Then the third is you need to avoid the use of harmful substances. The fourth is a routine health. So the most difficult thing lifestyle diseases ni kwamba they develop without any symptoms mapema. So in the early stages of this lifestyle disease, there will be no symptoms. So which means you might that you have the lifestyle disease very late. So the only help is now to keep regular checkups. For example, blood pressure tests regularly. You can go for blood sugar tests regularly. Okay. You can keep your weight. Then you divide your weight in kilograms, divide by your height in meters, you square it in meters. So the value you get should be kilograms per meter squared. which means your weight, if you are like 70 kilograms and you are 1.7 meters, so that will be 70 divided by 1.7 squared. You square 1.7. Then let me do that calculation so that we have an idea. Okay, 0.7 squared, that's 2.89. So if you are 70 kilograms divided by 2.89, that is 24.22. That is your BMI, mass index. It shows you if you are a lady, you are still in the safe bracket. But if you are a man and your BMI is 24, the risk that you will develop obesity is very high. Okay? The risk that you develop obesity is very high. So when you are calculating your BMI, do it over and over. You have to do it often. So you just take your weight in kilograms, divide by your height in meters squared. If it is in 1918, for a lady, it can go to around 25. Still is okay. Why ladies are allowed wakuwe na hiyo BMI is because of pregnancy. For a lady to be pregnant, then carry the pregnancy to term, some fat in her body. Okay. But as men, we never get pregnant. Okay. So ukiwa na kitambi is a risk for a man. But for a lady, your BMI hata ikikuwa, because so long as it's not more than 25, you are okay. But for a man, if it is more than 20, then you are risky high. So you need to do that. You will never grow taller than you are. Okay. So the height you can say that is the tallest you can grow. So once you get into adolescence, you hardly grow taller, because there are two things that you cannot do at the same time. You cannot grow and reproduce. You can't. So once you attain reproductive maturity, that is adolescence, then you stop growing. Okay? Stop growing. We call it the growth purge. You stop growing at that end. So the height you have now, that's likely the tallest you can get. Okay. Just work on your weight. Okay, then another thing that always causes lifestyle diseases is mental health. So when you have, for example, chronic stress, that can lead to blood pressure, lead to poor eating habits. It can lead to abuse. So when you are under chronic stress, go for counseling. Okay, find someone to help you manage the stress that you are undergoing.
Disturbance.
Buddy, I don't know if you could just mute all these guys. So in the event that failed and you've now developed lifestyle disease, okay, then in which you can still try to control and manage it. So one of those ways is medication. So for some of those, for example, diabetes, you will need medical intervention. When you have high blood pressure, you still need medical intervention. Okay. So only way now to make it for this intervention to work, then to have the medicine affordable and available. So There is a concept of access. Access unaweza ipata. So ipata kama uko na pesa, pia utaipata hata kama uko na pesa na haipo, then haufanya namna gani ukapata. So there is treatment, but usually the only thing is accessibility. Okay. Then when you've developed the lifestyle disease, treatment alone will not help. You still have to adjust your lifestyle. Okay. You need to ask yourself, for example, if you are a diabetic patient, which means your blood sugar levels are high, then you now must to control your sugar intake. If you are a hypertensive patient, you must reduce the amount of salt you consume. If you are kama umekuwa na obesity, you must come up now with regular exercise so that you can now break down ile fat ambayo uko na. Okay. So when you've come up with these lifestyle changes, they will help to improve the treatment outcomes. So utatumia dawa lakini utabadilisha hali yenye unaishi. Currently we have what we call the workers. Back in the rural, these people are very vital because they help in educating the masses about these life diseases. And once they notice that someone has, they monitor the treatment progress. Okay, so they take the drugs and they follow up. These community workers will now end up being as if they are between the hospitals and the community. And if your lifestyle disease, the best thing to do is use a support group and peer networks. So having a chronic disease, living with a disease that is chronic can be very stressful and isolating. Because you might be the only person within that. You need someone else to share their experiences with you. You need someone that you can encourage. Okay? You need someone who can tell you, when I had that disease at the very beginning, this is how I went about it. Okay, so by joining a support group, you join their experiences to encourage each other, to learn how to cope, their coping strategies. Venye waliambiwa wako na labda mtu ameishi na for the last 4-5 years. What have they been doing? What did they not do? Okay, so such people, they can explain to you, they can guide you on how best to maneuver. Then the government now needs to come up with policies and ensure that the environment is conducive for people to stay. So it is the work of the government, as we saw it in public health. The government, for example, needs to create parks and safe places for people to exercise. Okay? It needs to regulate the tobacco and alcohol industries, because people smoke, when people take so much alcohol, that one is what is forcing them to these lifestyle diseases. So it's the government now to come up with ways to ensure tobacco and alcohol industries are regulated, and the consumption of the products from these industries is also under very careful regulation. Then tumeongelea tukasema kwamba mapema ndio best. So it means the government should come up with a way of including health education in school, so that people can know what these lifestyle diseases are and what to look out for very early on. Okay, so that waweze kujiepusha nazo mapema. Yes. So those are lifestyle diseases. We've seen what causes. We've seen the risk factor, how you can prevent occurrence of those diseases. If there is a question in the chat so that I have a look at it, because our next discussion is about mental health. So if you have a question, type in the chat.
Kemunto. Rachel Kemunto. Hey, it's good umejua you are doing the wrong thing. We don't want to close any interaction with the lecturer, but you don't need to unmute if you have nothing to say.
If you have a question, I want to begin the topic at 1:15. So you have a minute.
I've checked from YouTube. I've not seen any question. Let me also check this other side, Doc.
Okay.
Doc, there's a question between cooking fat and cooking oil. Which one is most healthy?
Okay. I think that's a good one. We saturated and unsaturated. Then you have what you call the cholesterol levels. So you can check on what is indicated on the container. But the safest, if you want to be safe, it's been indicated kwamba if you go for, I think oil, the liquid one. So if you go for oil, you are likely to be safe. So check on the cholesterol levels, but when you choose to go for oil, it's easier. It's chance that you might be safe. So no cooking oil is, okay, but the level of saturation and saturation which you find in the oil is better than all that you find in the fat. Unless if you are talking of very renowned brands, okay? When you are talking very renowned brands, but if you are not very sure, choose to go for the oil compared to fat.
Two more questions.
Yes.
Is it advisable, I'll read the two. Is it advisable for women with sickle cell to marry and have children? And then there's this one, is it possible for small-bodied people to suffer from obesity? As in, is obesity related to just the body size, or you can have when kakonde tu lakini obese inside?
Well, obesity is a factor of there are two things that will make you your and your weight. Okay, so let's say you are not tall, you're not very tall. Okay, you are not very tall, yet you have some weight that will make when you weight divided by your height squared upatie within the bracket. So it's the taller you are, the better. The taller you are, the safer. So you can be heavier when you are taller and still be safe from obesity. There is currently a debate whether we should use just BMI alone or we should use even the waist circumference. Okay. With the waist circumference inamaanisha waist pia uko na kitambi size gani? Because ukiwa na kitambi kubwa, it just means you have a lot inside your ndani ya within your thoracic area, you have a lot of fat. But you realize now when there is too much fat in your thoracic area, that's where you have your heart, that's where you have your liver, that's where your kidney. So all your vital organs are within that area. Okay. So when you have a lot of fat accumulation in especially the thoracic area, then it is a higher risk. Okay. So it is not just a factor of how thin or how tall or how skinny or how fat, but it is a fact of how tall and how much fat do you have within where your organs are. So you just deal with your waist circumference. And these days, it's not even just something to do with the wanaume. There are some ladies pia unaona akona tumbo imekuwa kubwa sana. So the more fat found inside your thoracic region, the higher the risk that you can have obesity, and there is fat accumulating where your most organs are. There's someone who asked about sickle cell, whether they can marry or not marry. Sickle cell is a lifestyle disease to begin with, but I will just, because it's a genetic disease. So sickle being genetic means if you have it, then within your family, there are genes that predispose, and possibly you inherited what we call the recessive alleles, so that the sickle cell can manifest. So when there's something we call genetic, with genetic cancer, you need to go with your partner. Then they test you from a genetic level. Waone kuna uwezekano gani na yeye kuzaa watoto ambao wako na certain genetic diseases. Because with a genetic disease, there is hardly any treatment. Sababu, it is a genetic mutation that leads to that disease. We have a lot of sickle cell pahali penye kuna malaria. So you find it within the Western Kenya region, ukienda Nyanza, the coast. Because sickle cell, when you are heterozygous, when you say you are a carrier to sickle cell, then unakuwa resistant to malaria. Kuna malaria yenye huwa Plasmodium falciparum haiwezi kaishi ndani ya your red blood cell. Carrier. We call that heterozygous advantage. So inamaanisha when you marry, chances are that after you are a carrier and whoever you are marrying is also a carrier. Okay? For the biology students, ama nyinyi mnafanya biology, mlikuwa mnafanya kitu inaitwa, when you cross that, a carrier and a carrier, there is a very high chance kwamba utazaa watoto wenye wako wameinherit the recessive. So marrying and not marrying, a decision that we geneticists make for you. But it is our responsibility to advise the basis of your risk levels. Tukwambie mkioa, kuna uwezekano kwamba mnaweza zaa mtoto mwenye ako na moto. Then now is upon you to make a decision whether to proceed or not to proceed. Okay. When you have sickle cell, You are just a normal person like the other, only that you might have the sickle cell attacks sababu una oxygen haijakuwa supplied vizuri to your extremities, kuwa na hiyo uchungu. Okay, but you need to undergo genetic counseling before you marry, so that you know the levels of risk zenye utakuwa watoto wako. Mboni?
Yes, Doc, I'm seeing some two hands, one from Osoro, another one from Sheldon Otieno. Maybe as they unmute, there is also a concern here about what about too much spices in cooking food? Can it lead to your lifestyle? They are really concerned about this Royco thing. I don't know what you can tell them about the spices.
Yes.
Especially Royco.
Yeah, the spices. Some of those, okay, what have kwa tumbo yetu, kuna kitu tunaita normal flora. So you have here, which normally they are supposed to be tumbo yetu ili zitusaidie na digestion. So when you stabilize the pH, either by using too much spice or taking anything that will interfere with the pH, ama when you are stressed, you interfere now with the pH flora, the bacteria that will normally be found in our GIT zinatoka, then they are always replaced. Replaces them, ndio unapata hiyo kitu inaitwa Helicobacter pylori. So the Helicobacter pylori, once it replaces your normal flora, hapa sasa ndio ulcers. So when you use these spices, what they do, the spices go and interfere with your normal flora, the E. coli yenye inapatikana ndani ya tumbo yetu kikawaida. So once the E. coli has been, then it haitakaa bila flora. So I mean, is something that is not normal. So it is abnormal flora. The abnormal flora has kuleta shida now kama ulcers kwa mfano. So you are better off not extremes of things. Okay, you are better off just eating within the normal ranges, because when you go to very extreme levels, then you are likely to disturb the normal flora. Ukishatoa the normal flora now comes in, na hiyo abnormal flora ndio sasa put yake ndio unaanza kupata sasa kama ni hizo sasa. Okay, ingine we can finish that by 8:30, then we get back to mental health.
Osoro, unmute yourself.
Okay, thank you. Good morning, Doc.
Morning.
Okay, I'm asking that if you've talked about genetic diseases, so if some of your family members are suffering from, let's say, maybe diabetes or high blood pressure, then if you are following you are doing exercise, maybe you are following all the condition, must you also get those diseases due to, and because your family members have been suffering from it? Can it be genetically? Okay.
Yeah, I think I've understood. When your family members, when you have some lifestyle diseases around family, it just kwamba you are also likely to develop them. So what you need to do anything that has to prevent the occurrence of the disease. Okay, so you need to eat healthy, you need to practice, you need to avoid harmful substances, you need to avoid chronic levels of stress, because it just means that make you to be at a higher risk are within your family. But we said the genes alone cannot cause it. It is the genetics plus the. So because you didn't choose the genetics, you choose the what? The lifestyle. So you live better. When you live in a better way, then you reduce chances that the diseases will occur. So you need to do everything to ensure you prevent the occurrence. So you need to exercise, you need to eat healthy, you need avoid anything that can cause the disease. Okay. You can have one, then we continue.
Sheldon and Juma Job, your hands are raised. Ask your question.
Thank you so much. Good morning, Doc.
Morning.
Thank you so much. Allow me also differ with you when it comes to aspect of fat and oil. Because, the reason you have just given, I think it is not substantiated based on the facts. We will not sabotage the aspect of oil. In fact, because we are aware that oil contains a lot of glycerol, it contains cholesterol and triglycerides.
Triglycerides.
Yes. And this normally has a lot of effect when it comes to a disease, the so-called obesity. So based on the reason that you gave us, that you think that oil are far much better than fats, allow me to disagree with that and give the remedy of the same. It is in order that we use the minimum amount of oil when we are using oil in food that we are using. So the best or the substantiated evidence here is we minimize the amount of oil we use. But both of them, they have a lot, but compared, there are a lot of complexes when it comes to fat. I think I'm so much clear and precise about that. Thank you.
Okay, I think the only thing that makes what you wrong is when you tie it to obesity. Mostly the effect of having too much oil, that fat, okay, even when you eat too much starch, your body convert it into something that is not soluble in. Starch is soluble in water. So the only thing that is not soluble in water, which you convert it to, is fat. So when you eat anything too much, when your body has a surplus of it, will always convert it into fat. So usually, after it has converted it into fat, where is that fat deposited? That's the most important biological question. With obesity, it just means you have too much fat for your height. But the highest risk level is when now you have the fat being deposited either along the lumen of your air passageways or your. That's where the highest risk comes from. When you are talking of the triglycerides and all that, we have the saturation levels. Any chemistry student can tell you that when you look at an oil on the basis of the saturation levels and which the unsaturated fats, the levels of the two, they differ. The level of danger comes as a result of these differences. Okay, so irrespective of what you do, for example, when we use too much, so if you want to cook meat, there are some people who will want to use, if it's fat, mmoja ataweka kijiko moja, mwingine ataweka vijiko ngapi. Okay, but at the end of it, based on the saturation levels, and that is now where the glycerol emanate from, is you are safer using oil than using fat. Okay, because currently we have so many brands. Na watu wengi ukienda kufanya shopping, you look at the cheapest instead of making the most healthy, because we understand we are in difficult economic times. So present with the two, fat and oil. Don't think about, because even if you ate ugali, a lot of it, the excess will still be converted to oil, or that fat will be deposited somewhere in your body. Think of the saturation levels of the two. Go for the oil, you are likely to be safer. Okay. Let's stop there. Let's begin looking at mental health. Okay.
Doc, maybe just one.
Yes.
There's a lady called Sandra. Her hand is up. Maybe we can also hear a question.
Okay. Sandra
Sandra Mtuba. Sandra, unmute yourself. Yes.
Okay, my
Ask.
question is my question is like they always say that Royco cubes causes ulcers and also blood attack, or they can cause blood vessels, not blood vessels. I don't know how I may put this question. Is it true or not?
Uliza kwa Kiswahili, Kizungu inakusumbua. Liza iingie vizuri.
Okay, wanasema Royco cube causes ulcers and also heart attack. Is it true or not?
Okay.
Doc.
On the aspect of ulcers is just because when you use most of these things, they will disturb what we call flora. Once they've disturbed the normal flora, replaces hapo sasa ndio una vitu sasa kama hiyo helicobacter. When helicobacter, because ulikula roiko mingi, some of these spices mingi kabisa ambayo iliharibu your eco, then whatever replaces eco, hiyo sasa ndio inasababisha ulcers. With the I cannot for sure say it causes, because I don't see any fat content yenye unaweza sema itakuja iline. It will come in the lumen of the blood vessel. I don't, but causing ulcers, yes. Heart attack, I'm not sure. Okay, that one.
Hello, Doc. Hello, Doc.
Hello, the last one, sure. That is the last one. Yes.
Yeah, thank you. My question is about cancer. The other time you talked about cancer and you say that cervical cancer affect women because they have the cervix, and prostate cancer affect men. And you said a man having sex with a lady that is affected with that cervical cancer can contract the disease and transmit to another woman if at all they have sex with any other woman. Does it mean that if cancer can be transmitted by sex, can we term it as one of the STIs? And again,
Yes.
how many women or ladies this man can transmit that cervical cancer to? Thank you.
Cancer has many causes. One of it is infectious agents. Not all cancer, all types of cancers are caused by infectious agents. But we have, for example, cervical cancer, which is caused by the human papillomavirus. It is cervical cancer because it affects. You have prostate in men, but women don't have because they don't have a prostate. Only men have the prostate gland. So when as a man sleep with a woman who has human papilloma, you get the virus. So, a man, you are not getting cancer, you are getting because that is a sexually transmitted infection. Papillomavirus. It is transmitted sexually. So when now you go and sleep with a lady without protection, because mutaenda mpime HIV, mpime kila kitu, lakini hamutapima papillomavirus. Okay, so you infect this lady with the human papillomavirus. You are not infecting her with cancer, infecting her with the human papillomavirus. It is the human virus which, when it finds, that is now what will cause the cervical. You've not infected her with the, you have infected her with the what? Human papilloma virus. You are infected with that virus unless you go for treatment. Okay? So ukipata your human papilloma virus, you can infect as many you would ever sleep with without protection. So a factor at uta infect 10 so that sababu unasema nimefikisha 8 so then nitakuwa nimemaliza. Hapana. You have the viral infection, you have it. Okay. So cancer in itself is not sexually transmitted. Case, what is sexually transmitted is the infectious agent. Okay. It is the infectious agent. That is what is causing the cervical cancer. So you are getting the human virus. As a man, carry it because you don't have a cervix. So the papillomavirus lacks cause the cancer. But when a woman gets it, she has a, then a human papillomavirus can now cause the cancer. Someone asking, does every man have papillomavirus? No. The ones wenye walienda wakala wenye ako nayo bila protection, hao ndio kuna uwezo kwamba wako nayo. Okay. So cancer is not an STI. Cancer is not an STI, but there are some agents that can cause cancer. One of it is the human papilloma virus. Yeah, I think we continue now. Otherwise we will not finish. Unajua sasa leo ya mwisho. We must finish today. So we just have to look at mental health. So when we looked at health, we said that you cannot say you are healthy just because there is an absence of disease. So in the same way, mental health does not just connote the absence of illness, mental illness, but instead, it is that state of well-being where as a person, you can understand your strengths, your weaknesses. You are also in a position to cope with the normal stresses of life, what you encounter in life normally. When you the stresses you encounter in school, for example, the type of stresses you encounter in relationships, okay? And you are able to work or effectively in the face of all different types of stresses in the course of your life. And then most importantly, when as an individual able to contribute positively to your family, the community. Okay. So if you are in this state of well-being, that you can use your abilities, weaknesses, and your strengths, you are in a position to cope with normal stresses of life. If you are a student, mambo yako ya shule, you girlfriend, zile shida mnapitiana na boyfriend, but you can manage them. Sio hii yenye imekuwa inatokea juzi, watu wanaumizana, wanafanya namna gani? Hapana. Okay. Still able to study as a student effectively. Okay. Challenges here and there, but you can still go to class. You can still do your work. Then, if you belong to any community here, okay, but you can make contributions to your family, then as a person, I'll be talked of being mentally healthy. Okay. So when you are of good mental health, person, you will be able to live a life that is balanced and so balanced because you can contribute to all the aspects. Kwani shuleni utakuwa sawa, socially uko sawa. You have a relationship somewhere with your friends, not even just your girlfriend, but even your roommate. How do you relate with your roommate? If you are in a position to deal with us and still have all that balanced, productive as a person, then you can be said to be of good mental health. So mental health is important, just like any other physical health. Because when a person is healthy, then you are in a position to make good decisions. Then you are in a position to handle stress better. Okay? When you are mentally healthy as well, you are in a position to build relationships that are healthy. Then, because you are students, you will be in a perform well, even in your study. But when you have poor mental health, then that will affect how you think and your ability to concentrate. Then there are people who have an issue with them, sadness, anxiety, okay, just because their mental health is poor. When you have still poor mental health, the way you behave changes. You will appear to be withdrawn, for example. Okay, unaona tu unafika mahali rafiki yako hata ukipiga simu hashi. Okay, ukimtafuta anakuambia niko tu. Ni kama of late una behave hapana, niko sawa na nanyamaza. Okay? That is a sign that possibly they are having some mental health. Then at times, someone who was not very hard, who didn't have a lot of aggression. Maybe your relationship with someone all along hakuwa violent, but mahali a small mistake you realize anakupiga ama his levels of aggression zina change mara moja. An indication that this person could possibly be dealing with a mental health issue. Then mental health, when it's poor, it will eventually affect physical health. Because utaona kwamba your sleep pattern inabadilika. Unapata mtu halali. Okay? Then, of course, mchana utakuwa umechoka sana because you are not resting properly. So it means mental health can mess up your entire life because it is messing up your relationship. It's messing up your sleeping. So it messes how you are able to work during the day. It is messing up how you think and your ability to concentrate. So it means when you are in an exam, you cannot think the way you should do properly. Then even when you are in a lecture or a class or even a discussion, because of the mental issues, you might not be able to even concentrate. Okay. So the mental health will not only you in one way, but they will affect you holistically. And what is important that we need to understand is that the challenges that emanate from mental health, they can affect anyone, irrespective of age, gender, the level of income, and even the education. So it means everybody is at risk of these mental health challenges. But now, mental health issues are a burden. people who have them are not able to receive help. This is mainly, for example, in the developing regions or countries, and the main ni vitu kama stigma. Ikisemekana tu mtu shida ya kiakili kwa mfano, many people will tend to stigmatize that person because wrongly they associate mental illnesses to possibly curses, kwamba huyo mtu amekuwa cursed ama amerogwa ama alitumia madawa ya kulevya. No. So you end up being so stigmatized whenever you're known to be undergoing these mental health issues. The other thing is the limited. So the professionals who are able to offer services ni wachache sana. Yet the people who need ni wengi. So it means the resources are very limited. Wenye wanahitaji usaidizi ni wengi na kutoa huo msaada ni. Okay. Then the third reason why not many people are able to receive help is social and economic factors. So poverty levels, unemployment, family problems, then a lot of conflicts that we see. Those ones can increase the level of stress. Whenever the levels of stress are increased, then the risk of mental health also increases. So when you are in a poor, when you are living in an area that is condemned to poverty, for example, when you're that person, you are unemployed, then you're having so many family problems. Those ones can increase the level of stress that you are subjected to as an individual. With the increased stress levels, you are also to develop mental health issues. Okay. So globally, WHO or World Health Organization estimates kwamba at least 1 in 4 worldwide, they will experience a mental health condition at some point in their life. So sio kama ni ya watu fulani, no, 1 in 4, that's a quarter. So in every 10 people, for example, people wanaweza pata hiyo health issues. Okay. So ni kitu ambacho kinatendeka. So ni mbinu tu ya kuuliza tutafanya kama hiyo kitu imetokelezea. Okay. So the main causes of mental health, they are a combination of different factors. Huwezi kwamba mental health inakuwa caused by a single thing. Several things will combine. One of them, biological factors. And the other factor, psychological factors. Then the third factors, the social and environmental factors. So the biological factors, we will look at causes that are to the body, then that are related to the brain. So one, you will see an aspect of genetic biological factors. Okay. So if, for example, you have mental illnesses running in families, then it means there is a genetic within that family. Okay. There is a genetic aspect. Okay. So genetics is an issue. You might have a son or a grandchild, them suffering from a mental health issue. So it means running in that family. The second thing under biology, something that is related to, okay? So we call it the brain chemistry imbalance. So there are things that help messages when you are thinking. So to transmit messages, we call them neurotransmitters. So this, whatever is needed to transmit the information when you are to send the messages between your various nerve cells, those chemicals need balanced. You need balance in your brain. When you have an imbalance, you have either very few or too much of these, what we call neurotransmitters, then they will affect not only your mood, but they will also affect you. Okay, so it means of the causes is just about the imbalance. You either have too much of some chemicals, too little of some chemicals. Then something else that causes mental issues is when you have a chronic illness. When something is chronic, it means so. For example, if someone HIV, for example, if someone has cancer, so diseases can make someone to live under stress, under fear, or under stigma. So because of that illness, then they are likely to get into depression. So it is which is physical, ndio imesababisha now the mental health issue. Depression has been the illness, which was brought the enhanced stress levels. Okay. There's factors that relate to psychological factors. Psychological factors deals with your thoughts, emotions, and your experiences. Okay. So these psychological factors, they are linked to how a person's life experiences and emotional state. Yale ambayo umepitia kwa maisha. Okay. They will have somehow. So the first thing is trauma and abuse. So trauma refers to very painful or shocking. For example, if someone was sexually abused, okay, or if someone was in a relationship yenye alikuwa anapigwa, boyfriend or a girlfriend who was beating you up. So in such a state, you will be undergoing a trauma. Okay. For if you are born in a family na mama wanapigana kila wakati, the environment is so toxic that you are always subjected to very painful or shocking, because baba akilewa labda anapiga na nyinyi watoto pia. Okay. So such a thing will most affect huyo mtoto kiakili. Okay? Because ya pitia katika ile familia, they've been exposed to violence. Hajawahi ona mama na baba wakikaa chini. No, hao ni kupigana kila wakati. Okay? If you're also in a relationship where every time, that becomes more of like your definition of a what? A relationship. So it will affect the way you perceive relationships. Okay. And if you are not helped to of such a relationship, then you can develop some mental issues. There is something post-traumatic stress disorder. So when you have that post-traumatic disorder, it means after the trauma, because it is post-traumatic. So you've undergone some, you've been raped, for example, but you're experiencing flashbacks. What you underwent. So that is a stressful disorder endeka sababu ulipitia kitu fulani. So when you have post-traumatic stress disorder, always have or experience flashbacks. Utakumbuka saa ingine hata umelala na ni kama unaota kwamba huyo mtu bado anakupiga ama bado anakufanyia hicho kuumiza. Okay? So all those will almost all impact maisha ya mtu na akili yake, na hiyo ndio ya mtu akuwe na some mental health issue. So kama umepitia the post-traumatic stress disorder, kama uko, the only option ni kupitia nini? So you go see a counselor so that they can walk through that. Okay. So the third inaweza sababisha mental illnesses is social and environmental. So these are factors relate to the living zenye wewe as a person uko. So they come to your environment and your daily life. So for example, as a person, if you are subjected to poverty and unemployment, that can make you lack basic, utakosa chakula, labda shelter, na hiyo itasababishia constant stress, na mara mingi hata inaweza kuletea nini? Depression. Okay. The second thing under this third group of factors is when you have substance abuse. When someone has turned to alcohol or drugs as a way to cope with stress. So mtu atakwambia bwana, mimi nakunywa sababu fulani, mimi natumia bangi sababu stress. Ukweli ni kwamba kukunywa pombe, bangi ama kutumia yale madawa haitatoa kile kitu ambacho kinaleta nini? But itaongeza to affect your mental status. Okay. Abuse ambayo imeletwa kutokana cause of stress, hiyo pia itakuwa ina worsen your situation.
Nauliza, anasema kuna mahindi 100, sijui kama mnaweza mchangia.
Nani?
Wewe mambo ya mahindi na 100 hiyo unatusemea hapo nini? Mute yourself.
Anasema wanaendanga.
Mute yourselves mkiongea mambo ya mahindi tafadhali.
Nimetoa class daktari. Just remove them.
Okay. The other issue from this category is social isolation and stigma. Okay. So when you have mental illness, most watakutenga. You'll be discriminated against. People reject you because umekuwa labda mwendazimu. Okay. So no to associate with you. So by doing so, you end up now being lonely. And that loneliness mostly affects your mental health. And because of that aspect, isolated and stigmatized, watu wengi, they now fear to come out na waseme ni kama niko napitia fulani. Okay? So many kwamba wakijua niko napitia hii changamoto watanitenga. So watu wengi, they just suffer bila. That means then even we have the statistics of mental health could not be accurate because many people fear coming out. They fear seeking help because wanajua julikana kwamba niko na shida ya akili, watu wengi watatenga. Na katika familia saa ingine unaona mtu anaanza kufanya. Okay? There are people, for example, ataanza tu kukula hata bila kuna. Then mnacheka tu mnasema mwizi anasumbua. Hapana, is a sign something happening. Mtu atabadilika tu, alikuwa anaoga kila siku anasema mimi sioga. Na mnacheka tu, huyu jamaa siku hizi anasumbua. Hapana, it is a sign. Okay. So when someone begins to change from their normal behavior, it is usually a signal. Kitu hapa ambacho kina but mara mingi just laugh it off. Ai, siku hizi Johnny anasumbua bwana. Huyu ile nguo alivaa Monday, Friday. No. So you just laugh it off, but it is an indication kwamba everything is not well. The last thing that can also lead to mental health under this social political instability and conflict. So whenever we have political instability and conflict, we end up having vitu kama clashes. Tunakuwa na vita. What is happening in Iran and all the other countries. So people who are used to very peaceful life now imeharibiwa just because of political instability. So such people, you expect a lot of mental health issues there. Okay. Just because of political instability and conflict. Okay. So how do we now mental health? One, we need to raise awareness, reduce stigma. So one of the biggest to mambo ya mental health care ni mambo ya stigma. Sababu wanajua tu kwamba wakijua niko na hii changamoto watanitenga. So wanajaribu kufika. Okay. So stigma just means having negative attitudes or negative beliefs people who have mental illness. Okay. So maybe you say, those people are dangerous. Huyo mtu ni mwendazimu atakunyonga. That's what to be told. Kwamba mwendazimu anakunyonga. Okay? Ama unaambiwa ako possessed, ako na majini mapepo ya. So then you begin, huyu mtu akifika, everybody takes off. Okay? So it means then, because people now fear to be stigmatized, they feel ashamed to seek help. They will hide their condition, okay, because they don't want to be discriminated against. To help, we need to educate the public. Mental illness is a medical just like malaria or diabetes. We need to encourage open conversation to mental health. Then the media, schools, and even community meetings, churches, they need to be used to help in spreading awareness about mental health. Another way to prevent is to build strong community support systems. Tumeona one of the main causes of mental health issues is stress. Kama cause are the basic need. If we have strong support systems, then we'll stand in for our people. Okay. When you stand in for your brother, you stand in for your friend, you reduce the number of people when you wanakuwa stressed because hana a basic need. So we need to stand in, we need to be a support system to our people, to our friends, to our relatives. By doing that, then we reduce the occurrence of this. We need to promote healthy lifestyle. Okay. Exercise regularly, eat healthy, sleep enough, avoid alcohol and drug abuse. Mainly because exercise reduces the level of stress hormones in our body. Then when you have good nutrition, that helps to the way that our brains function. Then when you sleep well, it helps your mind recover. Okay, so it means we can prevent most of these mental health issues just by choosing a healthy lifestyle as well. Then kitu ingine nasema kila wakati ni best. When you detect some of these mental health issues early, then you can them mapema. Ukizishughulikia mapema, you prevent worsening. Okay, so identify them early. Then the intervention, the provision, the action, the provision of help stage, it can prevent escalation. Then as a government, both national and county, to strengthen mental health services. They need to build and equip more mental health facilities, train and employ more mental health professionals. Okay. They need to ensure that mental health services be provided on healthcare facilities. Okay. Na haja kwa mfano Bungoma lakini unaambiwa hospitali Webuye. Provide the services in Bungoma, in Webuye, in Kimilili, so that people can access them easily. Okay. We have one more to go, which we must finish now. Okay, I will not question for that. I'll go into the last topic immediately. So that okay, with this last topic, we'll be looking at nothing here. We want to look at aspects of sex and sexuality. Okay, you want to look at sex and sexuality. So I'll not go into many issues, but I'll go and begin to ask, for example. Okay. So mostly if you are given a form, utakuwa na name, age, then sex. So in biological terms, sex refers to physical and physiological characteristics distinguished as being either as being a male, female, or intersex. So there are some physiological and physical that you have to look at. Then once you've done that, then you are in a position now to say, this person is a male, this person is a female. You must be based on a particular set of characteristics. Whether they are physiological, you need to do a physiological assay, test for the presence of particular hormones, for example. Whether they are physical, you might need to look at the presence of a particular organ, which you say, because this organ is present, then this person is male, this person is female. So let's try to break this down. In biology, there are things we call chromosomes. As humans, we have 46 chromosomes. These 46 are divided into two sets. So we have 23 pairs. So you get one pair from your father, another pair from your mother. Okay. But out of the 23 pairs, there are two chromosomes. There is one pair, which we call sex chromosomes. So those sex chromosomes are what now determine biological sex. The pair of sex chromosomes in humans, we call it X and Y chromosome. You have two, X and another X. So you have XX chromosomes. Then you end up developing to become a female. Okay. So someone who has two X chromosomes, they will usually develop female reproductive anatomy. Then they will eventually have second sex characteristics that are associated with the women or female. So it means if XX chromosome, your sex chromosome, sex pair of chromosome, you will develop traits that are associated with being a female. Okay, so we expect you maybe undergo menstruation, then at some point possibly become pregnant because you have the XX chromosome. When you have it as XY, then the expectation kwamba it will result in the development of a male person. Okay, so when you have one X and one Y, so you have XY, we expect that usually such an individual will develop male reproductive anatomy. So they'll have a testis, for example. Then among the secondary characteristics, later when they will have facial hair, they will develop a deep voice during puberty. That is the expectation from a biological perspective. But we know not everybody fits. Sio kila XX ama XY. Okay? Kuna wengine kwa mfano ako na what we call the Turner syndrome. Ako tu na 1X. Okay? So such a person fit into the XX or the XY. Ama kuna wengine watakuwa na X, X, then Y. X chromosomes and one. Okay? So it means you then cannot the occurrence of X and Y chromosomes to have those two categories. Because kuna watu wengine, they don't have just the XX, XY. They have one X chromosome and no other X or no other Y. So people XO or X0. Then kuna mwingine akona two X chromosomes. So where do you place these people? Okay. So it means there will be variations here and there in the way we find when we are allocating sex. There will be differences when we are allocating gender. Say this is a man because akona XY na mwenye akona XXY atakuwa nani sasa? Ukisema this is a lady or a female because akona X na mwenye akona X moja peke yake atafit wapi? Okay. So another way you can also look at what we call hormones. Hormones in biology are messengers. Okay. So they are messengers, they are chemicals which are sent around the body to deliver signals. So you can have different hormones, and we expect also of those hormones to be different in a person who is a female or who is a male, for example. So estrogen and progesterone are examples of hormones. These two hormones, estrogen and progesterone, they are known to primarily influence puberty among females. And they are also for the reproductive health. So estrogen will help in the development of sex characteristics, secondary sex characteristics. So like developing breasts, the widening of hips, okay? The regulation of the menstruation, hiyo ni kazi ya estrogen. then progesterone will increase when the preparation for pregnancy and maintenance of that pregnancy. So inamaanisha estrogen na progesterone kwa ladies utazipata kwa wanaume but at different amounts. Okay? But you still find hormones anyway kwa watu, akuwe mwanaume mwanamke. So then even the hormone effect huwezi, utapata pia kiasi kwa huyu mwingine. The one you can find in males is testosterone, ile ambayo inasaidia tu mambo ya male puberty and the associated characteristics. Okay. So back to anatomy. Okay, back to anatomy. Anatomy is when you look at the makeup of a body, mwili ya mtu, the anatomy. When you are studying, okay, the parts of any organism, when you are looking at the parts of an organism, then that is anatomy. So the of a body, the reproductive system, they play a key role in biological and reproduction. So we end up with now what we call the primary sex characteristics, the primary ones. Those are the sex characteristics that a person is born with. Mtoto akizaliwa tu hivi, mvulana atakuwa na nini, na kama ni msichana atakuwa na nini. Okay? So there are things that you will be born with and they will be used to assign gender or assign sex. When you are just born, those are the primary sex characteristics. The secondary sex characteristics, they will develop for puberty. Because they develop later in life, they are responding to the hormonal changes. We saw there is that will be found more in males, the testosterone, then we'll have estrogen and progesterone among, okay? So whatever develops later in a female is in response to those hormones. Whatever develops later in is a response to those hormones. So those are the secondary sex characteristics. So when as a lady, for example, you have your breasts developing, they begin during puberty because the chemical message, what we call the hormones, will increase in your body. Then as a result, response to the changes in the hormones, now you develop some, okay, you begin to widen your hips. Then there will be fat distribution, ile inakuja for ladies is around the waist. Okay, so ndio utaona the secondary characteristic wanasema the waist widen, then for men inakuwa around the kwa mabega. All that is happening in response to the changes in hormones. For men, the secondary sex characteristics, you now begin to have hair on your facial hair, beards. Your voice begins to, you begin to have an increase in your muscle. Okay, all that is
Hello, Doc. Hello, Doc. There's no audio. There's no slide. Doc, kindly check on your connectivity. We can't see any slides. We can't hear anything. Doc, you are muted. Class, kindly hold on as I contact the lecturer to check where there's a hitch. Hello, class. The lecturer has some challenges with the connectivity. So the class has been adjourned till next week. Same time, same place. Anyone with any question, especially technical question, you should be preparing. The lecturer has said that your cut is just on the way. He has not specified the day or time, but he has hinted that the cut might start at 5 a.m. next week. The day has not been communicated. It will be communicated. Anyone with any question? Those who have not logged in, who have not done ABCD, just ensure you are logged in, ensure everything is in place, ensure your phone has charge, has battery, ensure you are not telling me our phone was stolen. If your phone is stolen, you will borrow one from a friend. If you don't have a friend, start looking for a friend who will help you during that time when you'll be having the cut. With any question, someone is named Kibabi University, your hand is raised. Unmute and ask. Anyone with any question, ask. The class is officially adjourned. Yes, ask.
After the cut, are we going to continue with the lesson?
What does CAT stand for? CAT is a continuous assessment. That is not an exam. A CAT is a continuous assessment. Other units, do you stop at CAT level or do you continue learning till exam time? So CATs are continuous assessment in between the learning sessions. So I hope I've answered that. Anyone else with any concern, just unmute and ask. General questions not related to HIV. Yes, Techno, KL4. Okay. Just as usual, the classes that I normally support will only have one card. Okay, will not have any makeup. That one I have to tell you in advance. If you feel you want makeup, just ask for the makeup right now. Ask the makeup from the lecturer before we do our cut. Because if you miss this cut, you will not have any makeup. Those who want makeup, ask for the makeup early enough from the lecturer before we do our cut. You have no reason to skip an online cut. Unless you are on a life support machine, you cannot lift your hand. Hata ukuwe kwa matanga, you can always be crying, ukikuja ukijaza ABCD. You have no reason. And please, if you miss this cut, never step in my office. Just go see the lecturer direct. We really don't have that time of playing around. So prepare. When we communicate the date, don't say you never had, or you never saw, or your phone was not having bundles, whichever excuse. If you know you don't have bundles, look for someone who has bundles who will be giving you the information of everything that is taken. But for me, I will not pick any excuse for missing out an online cut. If it's a physical one, you will avail yourself. Why not just do an online and life goes on? Start preparing for that cut. We will communicate. If there's anyone with any question, ask. Don't wait till the day for the cut is when you are saying you are not able to log in. Don't inbox me. As I said, anyone who inboxes me is just, as in I will not reply. If you have any challenge, you need to come to the office. Technical challenge. Let me see if there's anyone with a question on YouTube. Anyone with a question on YouTube? Yeah. Nothing more. I think we'll meet next time, next week. Just prepare for the elections. Be cautious. Stay safe. Ensure you are on the right side of the law. Sije ukapatikana kwa matatizo yenye ungeweza epuka. If there's anything you can avoid, please avoid. Please avoid. Let's also try to avoid the destruction of our property. Ukivunja desk, hiyo desk utahitaji kukalia kesho. Please, let's avoid destruction of property. Mostly the university is trying to safeguard your documents. Not really even the infrastructure, your documents. You will need those documents. We really need them to be safe. So msifikie mahali mukafika kwa documents sana. Yes, we have the soft copies, but it might really be a problem to you. When we lose your documents, you might not get. Someone is asking, will we pay for damages? I don't know. But common knowledge is normally you pay for the damages. I remember when we striked some time back, kila mtu ulikuwa unarudi peke yako na pesa mkononi direct ya kulipia damages. I've not been to the university since Friday. I don't know what is going on there, but I heard there was a lot of destruction. Please, let's not destroy what is helping us steer on our lives. Tunaweza piga kelele, turukeruke juu, tutoe stress kwa njia inayoeleweka kidogo. Tusiharibu property. That property, hata ukienda huko uvunje tuseme my office, I can relocate to any other office and still work. Even if you have grievances with me, you can go and work from another office. And you know utakuwa umeharibu mali ya shule. Sio yangu. I have no office there. That is a public office. Wale wenye ukuja kwa ofisi yangu, I normally tell you, this is a public office. Sit. Make yourself comfortable. Sit. In fact, I normally serve students when they are seated. So those are public infrastructure. But if you destroy, most likely you will have to pay. I meant to understand there's some meeting, Senate meeting today or somewhere. That is where the decisions are made. So, Metrin, don't worry. But mostly you might pay for the damages.
Kuna
Some units,
qualifications za kuingia kwa siasa.
qualifications za kuingia kwa siasa, I don't think. Yeah, I normally hear. Yeah, there are things like school fees. Just check on your constitution. Uliza wale wenye wako in office right now. As a good student, you must know the constitution of your union, not your union, your organization, student organization. So there's a constitution. Ask for that constitution, go through. It has all those details. Kuna sijui mahali, you must have cleared fee, mahali, you must have some good academic, what. But what I know is a must is you must have reported. Because what identifies you as a student, you must have reported. So reporting goes with paying of some fee and all that. Other qualifications, I'm not privy to them, but you can check on the constitution. Any other concern? Any question? The class is done for today. Nataka niachilie mupige. Yeah. I think I'm also done. Wale mnataka kuongea sasa mnaweza jiongelesha. Piga story yenu kidogo. Before I close there. Yeah, mnaweza piga story hadi 10 before I close this. So you are free.
Ule mzee wa Mainda alisema
Mzee wako wa Maini ni nani? Toka class huko unaongea sasa hivi unataka kuongea. Toka hapa.
Unaambia nani?
Naambia nani?
Huyu anaambia nani? Muuliza